All right, welcome. We are live here from the Fixel studios here at the University of Florida and the Norman Fixel Institute for Neurological Diseases, and it's great to be here. This is our Wellness Wednesdays, and the Parkinsons Foundation has been just so terrific about providing education through this pandemic and really being there for the patients in every way. And it's just been just an honor and a pleasure to watch and to be part of the effort, and also to see everybody helping everybody. And I mean that in the most sincere way. Our patients helping each other, people helping our patients, and people helping those persons with Parkinson's disease, and the partnerships between the people with Parkinson and the caregivers and the community, and the true partnership and heroes. I want to remind everybody that Parkinsons Foundation has a wonderful, just an absolutely spectacular, top of class helpline. So 1-800-4PD-INFO. And I always joke that for those of you that are old enough, we used to have the rotary phones, that each number has letters on it too. So when I say 1-800, the number 4 PD info, those are the letters that you'll see it on the telephone if you look at it, if you're not familiar with it, and that'll help you to remember. And we have the best nurses. I mean, they're just fantastic, and they're there to answer your questions, to help you, to connect you with the over 40 centers of excellence that are all over the United States and all over the world. And if they don't know the answers to the questions, we'll talk, and I'll talk with them as the medical director and try to help. So thank you to Leilani Pearl for her leadership on this series, and Kathy Whitlock for making this happen, and John Lair, who is our CEO, and Jim Beck, who runs our research. This has been a great team to be with through COVID, and we'll continue to help as much as we can. So today we're going to talk about wrapping things up a bit, about what is the post-COVID world going to look like. And I think people are starting to get a lot of cabin fever, and we've all been at home and social distancing, and frankly it becomes somewhat demoralizing to have to sit in the house and to not be able to do your activities and go to exercise classes and take walks, and you're so scared of this virus, and you see the TV rolling all day long. All the news networks and news shows are firing out all this information about infections and rates and deaths, and it's very scary. And so I think that from a Parkinson community standpoint, everybody really responded, in a wonderful way to get the information out. And so these are the things that we know. We know that just because you have Parkinson's disease, we don't think that puts you at higher risk to get COVID-19 or the coronavirus, the current infection, okay? Just because you have Parkinson's. Now, there are differences, slight differences in your immune system compared to the immune system of people without COVID, okay? So there are slight differences, but in general, we haven't seen that. Now, we might find out that there's a slightly increased or decreased risk even. Well, we won't know that until years down the road when we get the data. So let's go on the assumption that you're not at a higher risk to get it. But if you do get COVID-19, you're at a higher risk. It's harder to recover from it. Your lungs may not expand as well with the Parkinson, because the Parkinson can affect the lungs. And you may be at a higher risk to get pneumonias, and even aspiration pneumonias, non-infectious pneumonias, where particles go down the wrong tube and get down into your lungs, and you may not be moving around as much. And so these things can put you at a higher risk. And so we treat Parkinson as a higher risk group, not to get it, but because we don't want our Parkinson patients to get COVID, because the recovery may be more difficult, for you. And so it's important to take that as our baseline. Like, where do we start? Now, we also know that the best treatment here is prevention, okay? And we talked even many weeks ago, we talked about things like the rumors that ibuprofen was bad for this and making things worse. And we talked about how that was probably going to be proven to be wrong, and how we make associations. So sometimes we see a bunch of people were on ibuprofen, a bunch of people had bad outcomes, it must be the ibuprofen. And then once we get the data, we realize that's not true. And in fact, now people are saying the opposite. Maybe ibuprofen's good. We don't know that. I don't want you running out to get the bottles of ibuprofen. But certainly drugs in that class called non-steroidals can bring fever down. And so we know from a symptomatic standpoint that could be good. We also commented early on, many weeks ago, about how we were concerned about hydroxychloroquine. It shows up on all sorts of drug screens for all sorts of diseases. Everybody jumps to hydroxychloroquine for all sorts of things, and we didn't want people prematurely taking it. It has side effects, it has other issues, and we're certainly not recommending hydroxychloroquine. And so we don't see the available treatments that are out there that you can get to address this. And so when we think about moving into the next stage, what have we learned? And what we've learned is that this is predominantly a respiratory bug. It means that it is travels through the air, and so this is predominantly the way that we're spreading it. And then, of course, by touching our mouth, okay, we can also further spread things, and shaking hands. And so we've all learned to kind of control our hands, keep them away from our mouth, wash our hands for 20 seconds or more, and wear a mask. And when we look at the data, it's actually striking. And one of the doctors here was sharing with me, this anecdote about Japan, and he said that nobody would probably say that Japan handled this crisis in a perfect way. However, their rates of COVID are way less than in the United States, and one of the differences is the masking that happens. And so we now know it is super important to mask. And in fact, in running a large neurology department with over 50 neurologists, with hundreds of people, including nurses, and we have 8 different neurology services, an inpatient and outpatient, I know that we haven't had a single case of COVID spread from a patient to one of our practitioners or staff, and we're all masked up. Okay, so masking is super important, and I want to make sure that the lessons, and as we move into the next stages of COVID, I want people to understand how important that is. And just the other week, I was picking up food for my family, for my 2 kids and my wife, and I went into this establishment, and I was the only person masked. People were at the bar, people were at the tables, and the servers weren't masked, and there's a sense of, well, everybody's doing it, it's time to lighten up. With Parkinson, even without Parkinson, but certainly with Parkinson, we don't want you to come down with this bug. So fight the urge to give up the masks. Masking is good, and facial coverings are good, whether they're surgical masks or cloth masks. These things are super important, and these are the things that we've learned. And also, we've learned that staying home isn't necessarily a walk in the park, and we now know, and we didn't have this experience before, but we have now an integrated experience where we understand that by keeping our Parkinson patients at home, we've kept them safe from the virus, but we've also worsened a lot of their motor and non-motor symptoms. We've worsened their ability to speak and communicate in some cases. We've worsened their ability to move. And so learning how, in this post-COVID world, to stay masked up, stay away from people, socially distance, try to take walks when there aren't a lot of people around, exercise, get out of the house some, but do it in a safe way. This is going to be the next step for our Parkinson patients. And we have a lot of patients in our practice and in practices throughout the world that we hear about through our Parkinson helpline, that 1-800-4PD-INFO helpline. It's 473-4636 are the numbers, 1-800 473-4636, or spells 4 PD info. We hear people telling us that they're worsening because they can't get out of the house, and they can't do their activities, they can't go to exercise classes, and so forth. So the next phase here is going to be continue with the washing hands and protect, and continue to socially distance, because until we have a vaccine, we're still got to be in full-on prevent mode. So today and for the next hour, we're going to be talking and taking your questions here live. And so we've got a live chat going here on Facebook. And so I'm going to take your questions. I've also been collecting questions from the helpline and from people who have sent questions in even before this session today. And so bring them on. We're happy to answer them. So first, just saying to Namaste, thank you. Good morning. Good morning also to you. It must be morning where you are. It's headed into afternoon here on the East Coast, and we're noticing that we have patients popping up here on the Facebook Live from all over the world. So welcome. And we have a question from Nick Cole. And Nick Cole says, in this post-COVID world, a recent article is suggesting the potential benefit of vitamin D supplements. What do you think about vitamin D? Excellent question, Nick. We actually don't know, but there is some emerging information about how vitamin D works and how it works in the inflammation pathway and how it works in the protein pathways in the brain and in the nervous system and in the immune system. And there is some emerging information that you might do better if you were on vitamin D before you got COVID. Now, vitamin D, so vitamins D, E, A, and K are fat-soluble vitamins, and so you don't want to overdose on those vitamins. So it's usually 1,000 units or 2,000 units. You don't want to take too much of it. But the key that we've been hearing, and we don't have full confirmation on this, so if you don't take high dosages, you're pretty safe. If you take high dosages, you can get into some toxicities. And of course, you can get some vitamin D just from some sunlight as well. But taking a multivitamin that has vitamin D might be useful, but it doesn't work according to the doctors, or theoretically wouldn't work if you got COVID and then you started taking vitamin D. So a lot of people have begun taking these supplements. Now, vitamin D has been recommended for all sorts of diseases for many years. And so we're going to have to see how the data pans out on this. But certainly most multivitamins, if you take a multivitamin of your choice, has vitamin D in it. If you don't take a high dose, it's not going to hurt you. And there are scientists that are engaged in this question. But again, here's the frustrating part about COVID-19. We're not going to get these answers in real time. Okay, we're not going to get the answers in real time. We're only going to get them after the fact when we have enough data to go back and analyze and to look. So it's super important that we continue to watch this. So Nick, we'll keep watching it with our helpline. We'll keep putting postings up on the Parkinson.org website, and we have a specific site on the Parkinson.org website, Parkinson.org/coronavirus, all in one word. You can also search coronavirus and Parkinsons Foundation and get to our pages. But we're going to follow that story. Super important. Will it have a role? I don't know. Multivitamins, good idea for your health, and you can get a little bit of vitamin D from some sunlight, but if you get out, make sure that you protect yourself with a mask. So Bob, we have a question from Bob Pearson. Thank you, Bob, for your question. Bob actually has a high platelet count. Platelets are the things that help with clotting that are in your blood. And he wants to know, since they haven't found an underlying cause for this, a lot of people call this thrombocytosis. Is COVID causing clotting, and am I at higher risk? Boy, Bob, I wish I knew the answer to that, but I can tell you some interesting things about COVID that we're learning is that patients who have had it are showing up with all sorts of what we call hematologic abnormalities. That means when you go to a center or a clinic and you get your blood drawn and they look at how many blood cells you have, white blood cells, red blood cells, platelets are the clotters. People who have COVID, it seems to be affecting these systems, and there seems to be a delay in recovery of them. We are seeing more of what we call hypercoagulability, and that means clotting within the blood vessels and inflammation, and some effects even after you have COVID. So some of this might not actually be the COVID itself, but it may be actually your body's reaction to the COVID. And so you're definitely going to clot well with a high platelet count, but having too high of a platelet count can also put you into trouble. We just don't have the answers. The best advice I can give you, Bob, is wear that mask. Try not to get COVID, because I don't know whether people with high platelets are going to be at higher risk. We just don't have that information, but I would be very worried about that, and I would be probably doubly safe in your case. So thank you. Hazel Snedden, thank you for your question this morning. Hazel talks about when she takes her dopamine, called levodopa, if you take it in the United States, called Matapar if you take it overseas in Britain or Europe or in other areas, in some areas of South America. She gets stiff only after she takes it. Well, it's interesting, Hazel. We are learning now things about the Parkinson medications, and it turns out that some people get what's called quote, on freezing. When the medicines come on, they actually freeze. Some people can get a little bit stiffer. And so the most important thing is that you sort this out with your doc, because sometimes stiffness is a different symptom. So sometimes it's that the muscles are stiffening because you're getting something called dystonia, where the muscles are fighting against each other, or the toes are curling, or the fingers are curling, or you're getting stiffness in an arm or leg. And so actually seeing a doctor and having them go on and off with your medications and having them see exactly what's going on, maybe even shooting a video, will help to make the diagnosis. And in some cases, we actually reduce the medicines to improve that symptom. And in some cases, we give botulinum toxin, which is something that is good not only for wrinkles. Before it was for wrinkles, it was for something called dystonia and for the cramping. And so you got to figure out exactly what it is, whether it's being caused by the medications, and whether or not you need to change the dose or the frequency of the medicines, add Botox, or there's some other thing like physical therapy or rehabilitation therapy that could be useful. So thank you very much, Hazel, for that question, and Henry Kostic, I hope I'm saying that correctly. Henry, thank you for your question here to the Fixel Studios here. You want to know, how do you attend your physical therapy and exercise sessions and still remain safe? This is a tough one. We know when you are exercising, you're putting out more oxygen and you're having more respiratory exchange with the environment. Okay, so this can actually be a higher risk time to spread COVID from person to person. And if you wear a mask, the mask reduces your ability to exhale and get out. So it can be very confining and very difficult to wear a mask during exercise. Most of our Parkinson patients were giving the advice that it might not be such a good idea to be going back to exercise classes in person, where you can spread from person to person, and also spread from the people that are teaching you the exercises, can also spread from all the people that they've been in contact with. So it's also understanding, and we call this contact tracing, once somebody gets the virus, going back to see their contacts. So even before they get it, you have to think about all these people that you are interacting with, how many people they've contacted, and how they can spread things. So the way that we have addressed this is moving more to one-on-one stuff rather than classes, and making sure that you protect yourself with a mask and that the therapist protects themselves with a mask. And so it's super important to do that. And I think that right now, getting into big crowded exercise sessions is not a good idea, but going back to PT, making sure that your physical therapists are protecting themselves and you're protecting yourself, and that also you're not in the crowded waiting room. You're making sure that you have safe distancing. Super important. So very good question. Post-COVID, get out of the house, take walks, try to stick with your care partners, try to stick with people that you know where they've been, and make sure they're masking and you're masking, and you should be okay. Like I said, we come in contact with COVID here at the University of Florida, and on my staff I haven't had a single case yet traced from a patient to one of our practitioners, and I will say that I believe that's because of the safety precautions, and particularly the masking. So Kelly Hobbs writes in, she's scheduled to have a redo of her 4th DBS surgery in North Carolina in July. How much is my risk elevated, taking into account COVID? Thank you, Kelly. It really all depends on how your hospital on the ground is handling it. So you want to get a sense of what's going on, how many patients do they have in the hospital, do they have enough protective gear for everybody in the hospital, are they putting protective gear for people that are coming into the hospital? And then in our situation, we're testing all of the patients for COVID before they go in, so we know the people that are in the house, so to speak, in the hospital don't have COVID. I think that the risks now in universities and in experienced medical centers are very low, so I think it's safe to resume back to elective surgeries, but that doesn't mean that you should lighten at all the restrictions. And remember, it's respiratory. Still wash your hands. And it's very good if they're checking COVID tests before you go into the hospital, and almost everybody is doing that. So thank you, Kelly, for that question. I think that was terrific. So Mike Benjamin wants to know why the surgery has to be redone. How often does it have to be redone? So I'll leave that as a discussion probably between you and Kelly. But in general, the DBS operation, sometimes the lead is in the wrong place, sometimes the lead is broken, sometimes there's a hardware issue, sometimes you need to relocate that lead to a different area. So there's a whole bunch of different reasons why you might have to have a repeat surgery, and you may need to just simply get your battery changed. And so we worked with the American Society for Stereotactic and Functional Neurosurgery to put a statement out for the surgeons about how to handle this for people that need battery changes and knowing who's urgent and emergent. And Svetlana Milosevic at the Emory University Center of Excellence in Atlanta, Georgia, put out a nice paper in the Journal of Parkinson's Disease that really outlines the algorithm of how centers should handle deep brain stimulation. And I think that could be something that's useful to you, Mike Benjamin, and also useful to you, Kelly Hobbs. And so although I can't interact and get some of those details, hopefully that will be of help to you. Kathleen Mason wants to know if I have confidence in LabCorp tests for antibodies for those who have COVID. Can they still pass it along to our patients if the test is positive for antibodies? Wow, great question. So there's this growing body of data, and let's call it data, that we're gathering about people that have these tests, where we look in the blood and we look to see what do the antibodies look like within the blood, and whether those antibodies can tell you that maybe if you have antibodies to COVID that you've been exposed to it before. In the perfect world, Kathleen, in the very perfect world, you get the test, and if it says you have the antibodies, then you've been exposed to COVID. If it says that you don't and you haven't been exposed to COVID, and in the perfect world, if you were exposed, your risk to be reinfected with COVID would be 0. We don't live in a perfect world. It does seem that it is possible to be reinfected, although much less likely. We still don't have a lot of data on this. But what we do have data on is a lot of these antibody tests, and even some of the tests, the diagnostic tests for COVID, are not great. In terms of the diagnostic tests, the swabs that go in the nose and sometimes in the throat, we know that PCR, polymerase chain reaction types of tests, and Bill Gates talks about this a lot with his foundation that's been involved a lot with infectious diseases, that we know that these PCR-based tests are better than other tests. And some of the tests are like a coin flip, 50-50. And so knowing what kind of test you're getting from a diagnosis standpoint. And the antibodies, it is really difficult. They're expensive. And until we get more data, because there's a lot of different companies competing to test you and to build products, there's a lot of different companies and a lot of different assays for antibodies. Till we get more data, more research data, we don't routinely recommend those. And until we can pool the data, we won't know how good they actually are. But there are a lot of reports of them being highly inaccurate, and it probably has to do with how they're run. What we call the isotopes? What are the things that the locks and the keys that these things are looking for? And so, at this moment, we are using it mostly in research. So if somebody's checking it for research, then I think that's great to help their research study. And we're still learning how useful they're going to be in clinical care. So thank you, Kathleen. Really great question. So we have a few questions too here from the helpline as well. One question that came in was, how long should I wear a mask? Well, great question, and the answer is, as long as COVID is around, you should be wearing a mask. And we do look at N numbers and, numbers of people, and there are different countries that are lifting restrictions. The World Health Organization has been great about measuring these numbers and getting them out to understand how much distancing you should have and whether you should continue to mask or not. At the moment in the United States, there's just COVID all over the place. You should continue to mask until the Centers for Disease Control and or the World Health Organization would recommend in your particular zip code in your particular area not to do that. You're at higher risk not to get COVID, but higher risk to recover from it with Parkinson, and so you should be masking up all the time with Parkinson disease and staying socially isolated. Now, it doesn't mean that you can't go out for walks. We don't want you to get cabin fever. We do want you to get exercise. We want you to get out of the house, but now we want you in this post-COVID era to stay safe, and we're so much more confident about the importance of masking and washing your hands for 20 seconds, and you can bring some hand sanitizer too, which isn't as good as washing your hands for 20 seconds and covering your face. Now, recently on our blog, Parkinson's Secrets, Parkinsons with an S, secrets.com, we wrote about, we interviewed an expert, Paul Davenport at the University of Florida, about wearing a cloth mask versus wearing a surgical mask that you buy or might be used in a hospital. And so a lot of people are super interested in this idea of like, what should I wear? What kind of facial covering? And in fact, a paper came out here in the first week in June in the Annals of Neurology, or the Annals of Internal Medicine, which is an excellent journal, and it had to be retracted. And that paper said that it was better to use that the testing showed that it was better to use a cloth mask than a surgical mask. And it turns out that they weren't comparing apples to oranges, and they didn't have the correct data for the interpretation. So they have now retracted that paper. What do we know? Well, we interviewed Paul Davenport about this. We put something up on the blog about cloth masks versus regular masks. It's super interesting. And it's actually been studied during influenza, right? So again, we're in the middle of a pandemic. It's hard to get data when you're in the middle of a pandemic. But as Paul points out, it has been studied during influenza. The surgical mask is actually better than the cloth mask, but they're both good. And depending on what kind of cloth you have and how many plies on it and how big the particles are. So we measure them in microns. Microns you can't even see with your eyes. So how big those particles are to get through the masks. And a lot of those surgical masks are designed to keep blood out and other things, but some of the other things may get through those masks. And so he just points out that it's very difficult to do these studies because you need to know something about the cloth, and you'd have to test the different plies and how many plies does it have. So some covering is better than no covering, and probably the more resistance to your breathing, the stronger it is for things to be able to get in or get out. Now, it turns out that one of the most interesting things that Paul points out is that the coronavirus isn't actually usually found on the inside part of the mask. It's found on the outside part of the mask, even in somebody who might have corona. So touching the mask is not a good idea, and that's why you see people taking the masks off and they use UV light, or they put it under the sunlight, on the console or on the shelf to try to kill off the corona. We think that might be a reasonable way to do it, but touching the front of the mask is also something that's not great. So some mask is better than no mask. In general, just general cloth versus surgical probably a little bit better, but some of these cloth masks may be awesome depending on how many plies, how many layers they have on them, and it's difficult to test all these things in real time while we're in the middle of a pandemic. But as Paul points out, there's a whole bunch of people, smart people, that have studied this during influenza, and so we need to go back and really appreciate that great set of data that is out there. Christina Neubauer, thank you for your question, talking about your dad's feeling slow and slowing down recently, becoming more tired, and it's hard for you to differentiate whether it's the disease or the medications because he's been in quarantine so long. Christina, we are seeing this over and over and over in our patients, that the quarantine is good for keeping our patients safe, but it has been very difficult on the Parkinson's symptoms, and we're seeing worsening in the Parkinson's symptoms, in the voice, in the movements, in the communication. And it turns out that the socialization is just so important in this disease, and that also contributes to the worsening that we see. And so, what we're trying to do is a lot of our patients are scared to go out there because they don't want to get infected because they have Parkinson, and they're being really careful. But what we're trying to do is help them now in this next era. So that's what this podcast, what this Facebook Live is about today. We're trying to help people to protect themselves, washing your hands, keep your hands off your face, and wearing protective gear and having protective gear on other people, and starting to move around, take some walks, try to do it in times where there aren't a lot of people around, stay socially distanced. Try to make sure that everybody's masking up, and do some even 12 feet. Some people are doing even more than 6 feet, 12 feet distancing between people, and try to get a little bit of socialization. But again, remember that term contact tracing. When you get COVID, people want to know how many people that gave it to you, how many people you've touched. So you go backwards. So you have to think every time you touch somebody, you have to think how many people have they touched. And so choosing people to socially distance with that are at lower risk is what some of the other countries have done, and trying to pay attention to that is important. But the cabin fever is, can be really, really, really terrible. So replying back here to this Benjamin and Kelly, we're talking about why is Kelly headed back into the hospital and may need to get a COVID test coming in, and making sure that she's safe. Her wires were suboptimally placed. As we mentioned, that's 50% of the cases that get redone. It's usually a suboptimal lead, and there may be some broken wires. And so, Kelly, we're all sending you positive thoughts, well wishes, stay safe, mask up, and make sure they're watching for you. But you should do well with the COVID, and should be able to get back in there and to get that fixed. So there's another question that came in here on community, and this one we're seeing quite a bit of from the helpline. My community isn't following guidelines about social distancing and masks. What should I do? So my community isn't following guidelines about social distancing and masks. What should I do? Well, what can I say except that there is all this pressure, this peer pressure to, you see everybody doing stuff, and everybody's getting cabin fever, and everybody wants to get out of their house, and everybody wants to get back to life. Be disciplined. Okay, be disciplined. This is not the time to just say, okay, I see everybody's going back, we're opening up. In the state of Florida is where I live, and this is playing out in multiple states around the country. In fact, this morning they're talking about putting an emergency declaration back on to Arizona, to the state of Arizona. And in the state of Florida, over the past several days, the cases have been spiking over 1,000, since reopening now. It takes a while, a week or two, and you start to see those cases coming back. And so by reopening and going back to business as usual, we pay some price. So remember, it's respiratory, okay? And remember that when you see people who aren't following, so I'll give you an example. I went to pick up food just for my kids and wife this past weekend, and I tried to zip in and out. I had my mask on, and I thought that the place I went to was closed except for takeout, but maybe they had just opened. But the bar was open, and people were crowded at the bar. People weren't wearing masks. The servers weren't wearing masks. People were all on the tables. They were not masking up, and no distancing. And you'd say, well, I could say, well, no, they're not doing it. Why should I do it? My reaction was everybody was looking at me like I was the one that had the infectious disease, like I was the person with leprosy or something like that. But you have to fight that urge to not cave in to that, and to stand strong. And we've even seen cases of people being critical of other people within grocery stores and other things when they're social distancing and wearing masks and making fun of you. You gotta really not get bullied by this. And if your community is not following guidelines and mask guidelines, you need to ignore that and make your own decision. And we're like your cabinet advisors. We're not gonna get mad at you if you don't listen to us. But if you're a member of my family or you're a patient in my practice, I strongly recommend that you that you wear a mask and continue social distancing, even if other people are not doing it. So thank you for that question. It's a really terrific question. Abdul wants to know, what is DBS? And sorry, we shouldn't use acronyms. DBS is deep brain stimulation. That's a surgery where we put leads down into the brain and we try to electrically change the circuitry and the way different brain regions talk to each other, Abdul, and it's one of the treatments for Parkinson. And some people that need to go to the hospital to either get a repeat procedure or get a battery, like Kelly, are affected because of the COVID crisis. And so we've been trying to put guidelines out and trying to help them. Now, another question that we're getting tons of, and I'm sure everybody who's listening wants to know this one: can I see my grandkids now? You know, can I see my grandkids? Come on, enough's enough. Can I see my kids now? Maybe somebody just had a baby. You want to get in there, and this is a very meaningful time, and people are missing these, very critical and important moments in their lives. And so how are we handling this, and what kind of advice are we giving to our people with Parkinson and to caregivers and care partners? Well, first and foremost, in this post-COVID era, remember, we don't have the treatment, and we don't have the prevention. We don't have the vaccine yet, and we don't have the treatment yet, okay? So, but we do know, and I gave you the example with our healthcare workers here, when people are masking up and keeping distance, that we're not seeing transmission. The transmission rate is very low. It's still possible, but very low. So if you have like a need, you don't want to obviously spread between kids, and the best thing to do would be to be disciplined and to see them through means like we have now, Facebook Live, by Zoom, by Skype, whatever the platform. I don't favor one platform, Cisco, over another. I don't want to push anybody's business up or down. So I think those platforms are great. Those are clearly still the safest. If you want to see them, you shouldn't be hugging them. You should try to keep your distance, 12 feet if you can. You should be masked up. They should be masked up. Try to keep it, relatively brief, and be sensitive to what they are doing. So let's say those grandkids have been in the house and they haven't been exposed to anybody, and they've been really amazingly, disciplined about their regimen. They're probably safer than kids that have been playing with all the neighborhood kids, going out, and interacting with people with or without masks. So a lot of it depends situation to situation. So the stricter that people are, the safer it is for you. And trust me, you don't want to be the one to give COVID to somebody else with Parkinson and vice versa. And we've heard some really, just awful stories, even of family members giving COVID to each other and it being a fatal issue. And so we want to be super careful. So look at every individual situation. If you want to see your grandkids, but it is a really unsafe situation, it's going to be one where they haven't been isolated, you haven't been isolated, they haven't been using masks regularly, probably not a great idea. Now, if you wanted to get into a better situation, some of our families are actually testing the kids, so getting COVID testing on the kids and the families, and then staying in social isolation for 2 weeks before they get together, and then doing masks and isolation. So that's another sort of more modern way. It's more costly, but a more modern way to get tested and then wait out the period of time. So that's another way people are doing this. But we're super sensitive to this, and I just feel for all the people that want to see their kids and see their family members, especially during these special times. So Heidi asks here that her husband's now manifesting cognitive issues, taking a drug called memantine, and still having some trouble. Heidi, thank you for the question. Memantine is one of the drugs. Some people find it useful, some people don't. There's not a lot of data on it in Parkinson's disease specifically. Where there is most of the data are called cholinesterase inhibitors, and so drugs like Exelon and Aricept and galantamines, there's a whole bunch of those. I don't favor one over another. Those seem to work a little better for some patients, but can also cause diarrhea and low heart rates and other things, GI side effects, nausea. So you need to watch the side effects. So, those are medicines that are used, and sometimes people use those without memantine, and sometimes using memantine with them can make things worse. And so you have to work through those empirically or just by trial and error. When I say empirically, I just mean by trial and error to see, what would be the right way to go. So Ron writes in, is scheduled for a third DBS lead coming up here in Florida. And should we wait to see how COVID-19 plays out or go forward? I think things are getting pretty safe now, Ron. And you look at the General Hospital at the University of Florida. If you're going to have it done at University of Florida, we have a command center every day. So I have a command center report. So we have 10 cases that are in the hospital right now of COVID on an isolated COVID ward. We usually see between 0 and 1 new cases, per day over the last 2 weeks. So it's a very low rate, and we test everybody that comes in. So there it's very safe. But in other areas of the country where the rates are very high and you can contact a lot of people, it might be good to wait. So I would look at the individual zip codes, look at the individual hospitals, and address that situation. But in a lot of cases, it's okay to head on back, wear your mask, and to stay extremely safe. So I think that's a really, really terrific question. So a question that just came in is whether we think COVID is going to return later in the year. And what do I do to prepare? So this is the so-called coming of the second wave of COVID. And this is like crystal ball kind of stuff. We're trying to predict the future, like what's going to happen, where are things going to go. And we really don't know whether there's going to be a second wave of COVID. But what we're seeing pretty commonly is that as we relax the restrictions, social distancing and masking restrictions, we are seeing second waves pop up even now. And I don't know if we call it a wave or a blip or, just a tiny ripple. Maybe we're seeing ripples back. But there's a good chance without a vaccine that we'll see it. The good news is that we're better prepared to deal with it. We have better testing capacity. We have more protective equipment. I mean, we did not have the amount of protective equipment that we needed, and that's what stopped surgeries and stopped a lot of access to care for patients and for caregivers and for people without COVID. And then we also have developed telemedicine capabilities. So we accomplished in the Parkinson field, we accomplished in 10 days what took us 10 years. COVID catalyzed the use of telemedicine, and that's really been great because it has allowed us, it has facilitated the opportunity for us to reach our patients and to get paid for it. Now, you all need to get out there and bang the door and be charismatic because they're talking about shutting off payment for telemedicine, going back to the way it was. And I think that you all need to get really loud as a community and not let them shut that off, because I think that has been a huge benefit. And in fact, people talk about that for chronic diseases like Parkinson. But in COVID, people couldn't get care without the diseases because they couldn't leave their houses. They couldn't even get regular care. So having telemedicine is really super important. So thank you for that question. We have a question coming in from Bangladesh. So welcome from Bangladesh. This is Chowdhury from Bangladesh. Wants to know about risk factors. He's 47 and has 7 years of Parkinson's disease. So again, we don't have the data to confirm that you're at higher risk, to get Parkinson's disease. We don't have the data to suggest that you're at higher risk to get it, but if you get it, it's much harder to recover from. And so at 47, it doesn't matter how old you are, you have Parkinson, that puts you at higher risk for recovery with your lungs and other things. Betsy Saris wants to know whether magnesium supplement for COVID prevention. Don't really have data on that. Betsy, we'll keep watching it on the Parkinson Foundation website to see what comes in. Nothing impressive. A lot of centers are publishing very small studies on vitamin D. Don't overdose on vitamin D if you are going to take it. 1,000 or 2,000. It's usually in a multivitamin is the safest way to take it. And some people think that if you don't take it, some scientists think that if you're not taking it before you get COVID, it's not going to help you. So we actually don't know the answer. It's kind of like ibuprofen and hydroxychloroquine. Remember, in the early weeks, we talked about this on this podcast. It turns out ibuprofen might actually be good. Certainly brings down the fever, and people thought it was bad. Chloroquine, people thought it was good. It turned out to be bad. So just be careful. But not a lot of data now on magnesium. Magnesium is usually in a multivitamin, so you could cover magnesium safely and cover vitamin D safely. If you take mega dosages of vitamin D, okay, you can get into trouble. So we ask people to watch out for that. Pasquale, thank you for your question about feeling worthless and sense of well-being is low, and the isolation. The question is it isolation related or not? Don't know, Pasquale. We see a lot of this. We also see 1 in 6 Parkinson patients who, according to the studies, get demoralized. That means they're not depressed, per se, okay, but they're demoralized. And this can be just from having a chronic disease, and it's treatable. But demoralization can be a very difficult symptom if not addressed. And so one of the things, Pasquale, that I like to do with the patients is get them involved with our licensed clinical social workers, our psychologists, talk through things, get the physical, occupational, speech, and swallow therapists in together, and get a psychiatrist on board, not necessarily always to give medicines, sometimes to give medicines. We do see a depression rate well above 50%, well above half, and 80% of our patients are on antidepressants in many of the clinics throughout the country that treat Parkinson's, 70, 80%. So we need to pay attention to all these non-motor symptoms, but a lot of times it's a whole bunch of things together. And this isolation from COVID is probably not helping things and maybe driving that up a bit. And so I think that's important. Kristen Barr, thank you for your question. You want to know what masks do I recommend? Are cloth masks effective? So I've been getting this question all the time, Kristen. And so yesterday on my blog on ParkinsonsSecrets.com, I put up an interview with an expert, Paul Davenport, because I'm not an expert on this. And Paul pointed out the retraction of the Annals of Internal Medicine paper that showed that cloth masks were better than surgical masks, and that it isn't so easy to measure the two of them during an epidemic or a pandemic, and so we know more from influenza than we do from COVID, and we do know something about coughing and masks and what to do and not touching the front and all of those things, and so we know that any mask is better than no mask. So a facial covering is good, and then it depends on what the cloth is made of, and it's going to be hard to test every cloth. But the more plies you have, the harder it is to breathe, the better the fit. The sort of the ultimate masks are called N95 masks. That's what healthcare workers wear. We get fitted for those as well. And they're uncomfortable. If you put an N95 on, they're super uncomfortable. But as Dr. Davenport pointed out to me, the more uncomfortable you are exchanging oxygen through the mask, that tells you less is getting in and out as well. People that wear masks and coverings versus those that don't get far less respiratory disease. So that ParkinsonsSecrets.com by Paul Davenport has a really nice interview on that and very insightful, and he taught me all sorts of things that I didn't know, and certainly way smarter than me on this issue. But the problem is we just can't test everybody's mask, and you'll see these cottage industries popping up left and right for, like selling masks and 2-plies and 3-plies and 4-plies and different things. You got your sports teams and everything on them. And so a lot of it just, depends on your comfort level. But also remember, if it's easier to breathe through it, it's probably not blocking as much. And that's a very, very rough and general statement that I'm making. So don't overgeneralize that. But it's hard to know. It's hard really to know how much that it's doing. So, Kristen Barr sending a message to Pasquale, making sure you talk to your doctor, you talk to your healthcare team, and Kristen, thank you for writing that. Pasquale, if you're demoralized or down or whatever's going on, just know that the non-motor symptoms of Parkinson are more disabling than the motor symptoms, and you can get help. And oftentimes it takes a team, and once we get help there, it's really useful. And I would also say, Pasquale, you could call our 1-800-4PD-INFO helpline, 1-800-4PD-INFO helpline at the Parkinson Foundation. The nurses are world class, and they'll help you to get, help to answer your questions and get you to a place where people can help you. So the Parkinsons Foundation has just posted some nice information on deep brain stimulation for Abdul. So thank you for that question earlier, Abdul, and thank you to the staff. We also want to mention many of you are going into the hospital. So Kelly was mentioning about having to go into the hospital and have a DBS redo. We had another patient that was talking about, should I go in to get my next lead placed? And I want to point out, and we had a whole webinar that's on parkinson.org/coronavirus on hospitalization and Parkinson during Corona. And we have these great aware and care kits. And if you look in the chat here, we are answering questions to Marty and Diana, looking at this aware and care kit. And for patient safety, you can click it here. They're free. We've given out over 100,000. They save lives. They have all the things that you need to be able to survive a hospitalization. And so this is really great. Rip-offs with your medications for the doctors, for the nurses, tells you what to do. Make sure that they know that you should get your meds on time, every time, how to write the meds, how they should write the meds in the chart, how they should administer them, and what medications you shouldn't get. And so this can be life-saving. It's one of the best programs and services. So Parkinsons Foundation has that 1-800-4PD-INFO. It's actually written on the side of those aware and care kits. So if you write into them, you can get one of those kits. You can talk to our nurses on that helpline. They're just awesome. So they'll be able to help you and step you through it if you do end up having to go to the hospital. Betsy Saris wants to know whether deep brain stimulation helps with freezing of gait. I just did another webinar for our Ending Parkinson's Disease book for that series that is going on. From Ray Dorsey is the lead author of that book, and we interviewed a patient here the last hour who did get improvement in freezing of gait, and we talked about that and how freezing improves in about a third, sometimes 40%, but about a third of patients, and they usually respond well to medications before the operation, but it is totally unpredictable. So it's not super predictable. And the best prediction is if your freezing gets better when the meds kick in and are working well. So thank you for that question. That's a really terrific and important question. We also had another question that came in just about in-person exercise and masks. And when I exercise and I deep breathe, it's really hard through the mask. Let me tell you, being out in the sun with these masks is really hard, especially during the summer. Got to stay hydrated with Parkinson. A lot of our Parkinson patients will pass out and they'll get $1 million workup for cardiac and heart causes, but it'll simply be the Parkinson, dehydration in the summer months, and sometimes the Parkinson medications can contribute to this. So first of all, stay hydrated. Second of all, again, if the fit of the mask and the thickness of the mask is good, it's going to be somewhat difficult to breathe through, and so the better masks are easier to breathe through. When you are exercising or you're around people that are exercising, in Paul Davenport's interview we did with him, he talks about this idea that you are expelling more when you exercise and at a greater distance and more particles. So you're at much greater risk to pick it up around people who are exercising. So just keep that in mind. And keep in mind that you want to stay safe. So if you're exercising at home, you may be able to do it without a covering with a spouse or a caregiver more safely than trying to exercise with a covering around somebody else. And it's, again, high risk. Even with the covering, people are having difficulty breathing. Those covers are coming off, and it can be really tricky. And so we haven't really been sending our Parkinson patients back in full to exercise classes, and prefer they still work one-on-one, masked up with a trainer or a personal trainer or with someone, or they exercise at home and use some of the videotapes and materials that are provided for by the Parkinsons Foundation. So Terry Andrade asks, she's from Oklahoma. So welcome from Oklahoma. We've had Bangladesh, we've had Oklahoma, we've had Europe, we've had the U.S., and so people from all over, South America writing in. So it's awesome to have you all here together this hour. They fly from Oklahoma, and they want to know when you think it's safe enough to fly again, and are the clinics open? So our clinics are open. Not every clinic is open around the country. We had to go through an extended procedure to become reopened. We implemented telemedicine. So again, we accomplished in 10 days what has taken 10 years of advocacy in Parkinson. And so we've been seeing patients all the way through. So if you need to be seen, we can see you by telemedicine. We are also seeing patients in person. If you're flying from one locale to another with your Parkinson, that can be a little trickier. So we ask that you discuss that with your team and discuss the safety of doing that and whether or not it's safer for you to remain in a telemedicine situation until things cool off a little bit more, or if you think you can protect yourself well enough on the flights to get back and forth and through all the different people to see the doctors. And so it's a case by case situation. But in general, we've been trying to keep people off airplanes at this point in time. So we have been advising people, unless you really need to get on an airplane, we've been trying to keep them off if we can. We can't always do that, and then we employ a lot of protection. And Amy Lindberg asks similarly about a family gathering that they want to have in Texas. And so if you're going to do a family gathering, be real careful of airplanes for sure. And a lot of people are making sure that they have 12 feet distancing. They're doing masking. And in the best case scenario, having the people that are going to gather get COVID tests and then self-isolate for a week or two before traveling, and just to make sure that they're not bringing you anything from the outside. That would be closer to a perfect situation. There's no perfect situation in this, but again, it's respiratory. We know, as I told the story of our healthcare workers here, we know if we're very vigilant with our masks and our washing of hands and not touching our face, we know that we can prevent the spread of this disease. And so that is, super, super important. So we're seeing a whole bunch of great questions still coming in. And what I'm going to ask everybody to do is to if I didn't get to your question, I would like to help you to answer it. And so I'd like you to direct it to our 1-800-4-Parkinson disease info hotline. And if our nurses can't answer it, which they can answer just about anything, but if they can't, they have access to me, and I'm happy to make sure that you get answers to all of your questions. Now, the final thing that I wanted to cover today in our last couple of minutes is we've seen reports coming out. There was one in the New York Times about deaths from other causes, including Parkinson's, dementia, and coronavirus, skyrocketing up to more than 25% above normal for the time. This is concerning. And I just want you to know that as a foundation, we have our eyes on this for the Parkinson community. We're not sure, as we're seeing death rates go up. We're not sure the relationship to COVID, but we suspect that at least some of these deaths are COVID-related deaths, directly or indirectly. And it just tells us that how careful we need to be. We also don't want to oversimplify the problem. Remember, at the beginning, people were saying ibuprofen is making things worse, and it's not. And in fact, now people are saying maybe it's making it better. People are saying hydroxychloroquine is making it better. It's probably making it worse. So I don't want to tell you that we have the data today, because that would be irresponsible. But we are beginning to collectively, appreciate what may be an increasing death rate. And it's not unexpected during a pandemic that we would see that, but seeing that increasing death rate, particularly among patients with Parkinson, dementia, and other things, it should draw our pause, it should draw our attention, and it should help us to refocus and double up when you're thinking about taking the mask off and you're thinking about getting too light with the social distancing. I do believe, ending on a positive note, I do believe we will get to a vaccine. And I believe that we'll get through this. And I want everybody to maintain positivity, but it's going to take time. Vaccines sometimes take 10 years. We're going to accelerate that up to a year, and people are doing great. There's 7 or 8 out there. But while we're waiting, be disciplined, wear your masks, wash your hands, don't touch your face, and try to get out of the house a little more than we had you at the beginning of our podcast series. Try to get out and fight some of the cabin fever, but do it in a protective way. The post-COVID world right now means we still need to mask up and be really careful, but when we're really careful, we can get out of the house some. Okay, so don't overdo it. Have a great day, and just know the Parkinsons Foundation, we are totally available to help you with anything that you need during Corona. Please call our helpline. Please call our offices if you need us. We're there. We have aware and care kits. We've given away over 100,000 of those. So if you're going in the hospital, get one of our free aware and care kits, and no question should go unanswered. So if you need us, we're there. So have a fabulous day, and I hope everybody can take a little positivity as we move into the next stage of the post-COVID world. And we'll keep you updated and keep watching, because we're going to have lots of education up on our website, and that's parkinson.org/coronavirus, all one word. So from the Norman Fixel Studios, thank you for spending the hour with us. It's been a pleasure and an honor to be with you today.